the Smart Sex Workers Guide to the SWIT. Sex workers are one of the key populations most affected by HIV due to criminalisation, precarious working conditions, barriers to consistent condom use, lack of access to health services, etc. The Sex Worker Implementation Tool, or SWIT for short, is a document that provides recommendations for implementing HIV and STI testing, treatment and prevention strategies that empower sex workers. This is a short summary of the good practice and evidence-based recommendations in the SWIT and the principles for their implementation. The good practice recommendations are: all countries should work towards decriminalisation of sex work and elimination of the unjust application of non-criminal laws and regulations against sex workers. Governments should establish anti-discrimination and other rights-respecting laws to protect against discrimination and violence and other violations of rights faced by sex workers in order to realise their human rights and reduce their vulnerability to HIV infection and the impact of AIDS. Anti-discrimination laws and regulations should guarantee sex workers' right to social, health and financial services. Health services should be made available, accessible and acceptable to sex workers based on the principles of avoidance of stigma, non-discrimination and the right to health. Violence against sex workers is a risk factor for HIV and must be prevented and addressed in partnership with sex workers and sex worker-led organisations. The evidence-based recommendations are: offer a package of interventions to enhance community empowerment among sex workers. Promote correct and consistent condom use among sex workers and their clients. Offer periodic screening for asymptomatic STIs to female sex workers. Offer voluntary HIV testing and counselling to sex workers. Use the current WHO recommendations on the use of antiretroviral therapy, or ART, for HIV-positive general populations for sex workers, and refer to the latest ones published in 2013, i.e. begin ART below a CD4 count of 500. Use the current WHO recommendations on harm reduction for sex workers who inject drugs, in particular needle and syringe program and opioid substitution therapy. Include sex workers as targets of catch-up hepatitis B immunisation strategies in settings where infant immunisation has not reached full coverage. Some principles for implementing comprehensive HIV and STI programs with sex workers. These principles underlie the 2012 recommendations and the recommendations in the SWIT. Community empowerment. Community participation and leadership in the design, implementation, monitoring and evaluation of programs. Programs should address structural barriers. Programs must operate at multiple levels, from the front line to the national policy arena. Programs should be holistic, considering all the services sex workers need, and complementary, finding ways to coordinate and integrate service delivery to be more effective and accessible. These recommendations and principles should be seen as a minimum global standard, applying equally to higher income countries and lower and middle income countries. Sex worker rights are human rights. We call for community empowerment and sex worker leadership in HIV responses. To learn more about the SWIT, read NSWP's Smart Sex Workers Guide to the SWIT.